primary focus of Loma Linda's mission trips is to help people give back tangibly. You know, we can always give our money, but to give of yourself, to be tangible in a whole person sense, I don't think there's a better testament.
I chose to come on this mission trip because it was one of the trips that had the behavioral health component, and it's been a dream of mine to do social work in another country.
I've always wanted to go to South America and experience the culture. It's definitely something that I would never experience back in Southern California.
I chose to go on this trip because I've been wanting to go on a mission trip since I started college, and I just never had the time to do it. And I'm graduating soon, so I realized it's either now or never, so I chose to do Peru because I've heard it's really beautiful and I've always wanted to see the country.
I wanted to see how the people interact with each other, the types of food they eat, how they play and socialize, and I thought it would be a great time to learn about people that I would never experience back at home.
I chose to come on this mission trip because I've loved mission trips in the past. They're always great experiences. You learn so much. I'm pretty sure I learned more than the people who actually come here to help. And I just really wanted a chance to use my nutrition knowledge.
Loma Linda University is here on a mission trip to implement health fairs and work at a kids' camp. I'm here for the behavioral health component of the mission trip. We were interviewed for local TV, and part of the focus for behavioral health was we emphasized the importance of practicing mental health wellness on a daily basis. We also emphasized the importance of practicing mental health wellness in conjunction with physical wellness because they really work together.
The group here, we've done health clinics and screened all kinds of awesome people.
I have been part of the nutrition team. We have been collecting data, doing nutrition assessments for the kids, trying to get a better feel of what the next nutrition team can bring when they come out here, and also some of the deficiencies in the population and the kids especially.
My role, I've kind of been helping out with the nutrition group and the EMC group, helping them teach the kids. We have a doctor here who's looking at any medical issues, and then I've also been supplementing with my own knowledge that I've learned in nursing school.
So as a group, we came here to teach people about basic health. So we had some health fairs, and we also got to run a small camp for the local kids. My role here was to train people in EMS, the local healthcare providers, and then to teach kids about basic hygiene, splinting, and bandaging. When we visited the local health post here, it was very interesting to see, and it was really helpful in understanding what the health needs are in Peru. The people here really wanted to learn about trauma and shock treatment, and also how to move patients without a gurney or backboards.
So my role in the summer camp was to help children and adolescents participate in playful activities such as obstacle courses, team building exercises, and it was wonderful because you see this wide range of age groups come together.
At Loma Linda, we learned to adapt our lessons to different populations and different communities. For example, in Peru, we had different ages of kids, and at one of our camps, we had kids from about ages 5 to 17. And we really wanted to encourage more of a protein intake.
And so one thing that they have down here that they underutilize because they sell it, they export it, is quinoa. Quinoa has a lot of protein.
So to get the kids excited and to get the kids wanting to eat protein foods, we created a superhero named Super Quinoa Man.
We created this superhero figure, and the kids were ecstatic. So I guess that's one example of a way we've adapted to this community.
Por mi parte, personalmente, lo han hecho muy bien. No son conquistadores, pero lo han hecho excelente.
This mission trip has contributed to my spiritual life in many ways.
I've just enjoyed being out in nature. It's so beautiful here, seeing God's creation and interacting with the people. They're so grateful and humble and thankful, and it's just been an amazing experience.
I feel like I have a stronger connection to God since I've been here, not only because part of the focus is, having a spiritual connection, but because there's been less distractions here that are very common to have in the United States, such as access to technology and internet.
I think humbling best describes this trip.
It's a great opportunity to be outside of your comfort zone, especially with the language barrier. We have so much going for us back in our hometown, but coming here, we have to learn and adapt to just a different environment.
In the United States, we are so distracted most of the time with everything, with media, with our jobs, with school, with keeping up with whomever. And to come here and to see and experience the people who are so joyful just to be. And just to be with their families and to have the opportunity to interact with us as the highlight of their week. It's humbling for each of us. The primary focus of Loma Linda's mission trips is to help people give back tangibly. We can always give our money, but to give of yourself, to be tangible in a whole person sense, I don't think there's a better testament